Good afternoon, Professor Julian and classmates of COM 100-0501. This is my speech. In the wake of the global pandemic of the novel coronavirus, many lives have been lost and several others have been infected with it. The state of New York reported over 250,000 cases according to the Center for Disease Control and Prevention. Because of the coronavirus, a statewide lockdown was issued, effective immediately for its residents, all except for essential businesses and employees. Schools, colleges, and universities were shut down. Public transportation limited, running only on vital provision. In addition, flights were suspended and a travel ban issued for countries like Iran, Italy, and the continent of Europe. Some people were in the beginning skeptical of the virus, finding it hard to fathom this new reality. Like many others, I followed all precautionary measures to avoid occurring this disease. Being a new strain of virus found in humans, the coronavirus is still without cure, which scientists are currently racing to obtain. Everyone has developed their own predispositions about obtaining and accessing information and equipment to protect themselves. This is why, not only for the coronavirus, but also for any other disease, health literacy is becoming increasingly important. And that is why today I'll be discussing the health belief model in the Personally Responsible Communication section of Susan Beauchamp and Stanley Barron's book, Introduction to Human Communication, Perception, Meaning, and Identity. I'll expand on the matters the health belief model consists of and offer my thoughts. To understand the health belief model of Chapter 14, Health Communication, we have to first recognize what it is and the purpose it seeks to serve. Karen Glantz, Barbara K. Reamer, and Kay Viswanath write in their book, Health Behavior and Health Education, Theory, Research, and Practice. The health belief model was developed initially in the 1950s by social psychologists in the United States Public Health Service to explain the widespread failure of people to participate in programs to prevent and detect disease. We have all seen or heard at least one health campaign ad throughout the course of our lives, whether it be at school, over the television, or on social media. And as Susan Beauchamp and Stanley Barron have written, these campaigns typically pursue one of two goals, either to raise awareness of important health issues or to change individuals' health behaviors and attitudes. Through this form of health communication, these types of ads are used to spread and influence change in a person's health choices. The health belief model concepts explore the reasons why people are influenced to take action, whether it be to screen for, control, or prevent an illness. There are 6 main reasons why people take action. Keeping these thoughts in mind, let's delve into what those 6 constructs are as per the health belief model. The first, perceived susceptibility. This refers to when people believe they're susceptible to a condition. The second, perceived severity. This is a person believing the condition has serious consequences if he or she were to contract it. The third one states a person's belief that taking action would reduce their susceptibility to the condition or its severity. This one is known as perceived benefits. The fourth, perceived barriers. It is the belief that the costs of taking action are outweighed by the benefits. The fifth is cue to action. It states that people are ready to act if they are exposed to factors that promote action. For instance, an email sent from your physician reminding you about your follow-up appointment. And finally, self-efficacy. This states that people are ready to act if they are confident in their ability to successfully perform an action. An example of this is demonstrating to your friends that you can still do 10 sets of lunges without a burnout. The health belief model of the personally responsibly communication section basically explains the actions that influence people to make decisions about their health. In the 1980s, prior to the direct to consumer prescription drug advertising becoming legal, there were many arguments of whether the consumer prescription drug advertising addresses ethical issues, like is it ethical to persuade people who are not in a knowledgeable position to judge the complexity of the medical issues alluded to in the ad? Write Susan Beauchamp and Stanley Barron. I would respond yes. Being in the know and making informed decisions about one's health is critical in understanding the health ads or campaigns and how it influences your decision to take action. Now that you've had a clear understanding of the constructs that influence decision making in one's health, I'll now give you a brief account of what I think. The health belief model, having first been developed as a research theory, has since been used primarily and majorly benefited by health service providers, according to Oak Ridge Institute for Science and Education. Overall, I've come to the conclusion, from doing research and understanding more about public health campaigns and the factors influencing people to make decisions concerning their health, is that for a health campaign to be successful, it must first be aimed at a targeted audience. Stephen E. Lucas, professor of communication arts at the University of Wisconsin-Madison, writes in his book, The Art of Public Speaking, advertising gives us an effective model. Successful commercials are aimed at a particular segment of the market. On a personal level, I can relate to the health belief model, the model's constructs, to which some I may have already acted on. When I felt that I may become sick or perhaps catch a cold from someone who already has it, I immediately make the decision to protect myself from getting it as I fear the outcome it will result in. This is called perceived susceptibility. Since the COVID-19 pandemic ensued, I am certain that many people and healthcare providers have used the health belief model to make decisions on the health of themselves and their patients. Researchers like Anne Herman, Alex Hall, and Anthony Perito have written in their Using the Health Belief Model to explore why women decide for or against the removal of their ovaries to reduce their risk of developing cancer article. This study identified and examined reasons for why women decided for or against the surgical removal of their healthy ovaries to reduce the risk of developing cancer. The results of this study suggests that deciding on whether to have an oophorectomy is a highly personal decision, which can be described and explained with the help of the health belief model. Conclusively, I've covered how important it is to have health literacy, what the health belief model is, the constructs it is composed of, and how I've acted on these very constructs. Now that you understand these concepts, you can see how the decisions you've made on your health have been connected to the constructs of the health belief model. Thank you.